Do you know the warning signs of blood clots? Blood clots, those knotty, hard lumps that form when blood thickens and clumps together, can potentially pose serious health risks. When they form in veins or arteries, they can disrupt blood flow, leading to complications like deep vein thrombosis or pulmonary embolism. That's why it's crucial to be aware of the signs that could indicate a clot. In this video, we're going to take a closer look at blood clots, focusing on 6 key warning signs that everyone should know. Understanding these signals can be the difference between timely treatment and severe complications. From the obvious symptoms like swelling in a limb to the subtler ones like a heavy ache, we'll explore each one in detail. So whether you're a health enthusiast or just someone who values staying informed about their health, this information is vital. Stay tuned as we delve into the 6 warning signs you need to be aware of. The first warning sign is sudden or gradual swelling in one limb. This swelling can be a clear indication of a blood clot, specifically a type of clot known as deep vein thrombosis or DVT. But why does this happen? Well, when a blood clot forms in one of your body's deep veins, typically in your leg or arm, it can block blood flow. This blockage can cause blood to accumulate behind the clot, leading to swelling. It's not just about the size of the swelling, but also about its sudden onset. You might go to bed with a normal limb and wake up with it noticeably swollen. Or the swelling could develop gradually over a few days. Either way, it's important to pay attention. Remember, our bodies are always communicating with us. It's our responsibility to listen. So when you notice unexplained swelling in one limb, don't dismiss it. Remember, unexplained swelling in one limb should never be ignored. The second warning sign is pain or tenderness, often in the leg. This discomfort may seem innocuous at first, akin to the sensation of a cramp or a Charlie horse. It's that twinge, that pull, that you might dismiss as the aftermath of an intense workout or simply overexertion. But here's the catch. Unlike the fleeting pain of a muscle cramp, this discomfort persists, sometimes even worsening over time. It's easy to ignore, to chalk it up to everyday aches and pains. However, it's crucial to pay attention to what your body is telling you. If you notice a persistent pain or tenderness in your leg, don't simply brush it off as a minor issue. It's important to consult with a healthcare professional. This could be your body's way of signaling a potential blood clot. Don't brush off persistent pain or tenderness. It could be a sign of something more serious. Next up, the third warning sign of a blood clot is redness or discoloration of the skin. If you've ever had an injury, you'll recall how the skin around the affected area often changes color. This is the body's response to trauma, and it's quite normal. But what if there's no obvious cause for the discoloration? With blood clots, the skin over the affected area can become discolored, often turning red or blue. This is due to the blood pooling in the area and not circulating as it should. This change can be subtle or quite noticeable depending on the severity of the clot and your skin tone. It's important to keep in mind that skin discoloration can occur for many reasons, not just blood clots. But if you notice a sudden change in skin color, especially if it's accompanied by other symptoms we've discussed like swelling or pain, it's definitely worth getting checked out. After all, skin discoloration can be a clear sign that something isn't right. The final 3 warning signs are warmth over the affected area, a heavy ache, and shortness of breath. To kick things off, let's delve into the first of these 3 signs: warmth. Imagine you're sitting in a quiet room and you notice a specific area on your body feels unusually warm to the touch. This sensation isn't due to external factors like sunlight or a heating pad, but emanates from within. This could be a sign of a blood clot. The warmth is caused by the blood clot disrupting normal blood flow, leading to an increase in temperature in that area. Next on our list is a heavy ache. You may be familiar with the dull ache that comes with overexertion or a minor injury. However, the ache associated with a blood clot is typically more persistent and intense. It's not a fleeting sensation that you can shrug off. Instead, it's a constant heavy ache that doesn't alleviate with rest or over-the-counter pain relief. It's your body's alarm bell, signaling that something is wrong. And finally, we have shortness of breath. This symptom can be particularly alarming as it can indicate a pulmonary embolism, a blood clot in your lungs. This type of clot can be life-threatening. If you experience sudden or unexplained shortness of breath, especially if it's accompanied by chest pain or dizziness, it's crucial to seek immediate medical attention. It's your body's way of telling you it's not getting the oxygen it needs. Let's review the 6 warning signs we've covered. Firstly, we talked about swelling in one limb. This can be a clear indicator of a blood clot, especially if the swelling is sudden and localized. It's important to not disregard this symptom as it could lead to severe complications if left untreated. Our second warning sign was pain or tenderness, often described as a deep throbbing or cramping sensation. This pain can occur without any obvious injury or strain and may worsen with movement or pressure. Don't mistake this for regular fatigue or muscle strain. It's crucial to listen to your body's signals. Moving on, we discussed redness or discoloration as our third sign. This may appear over the area where a blood clot has formed, often accompanied by the skin feeling warm to the touch. It's not just a simple rash or skin irritation. It's a potential red flag your body is waving. Our fourth sign to watch out for was warmth over the affected area. This is caused by the increased blood flow and inflammation in the body's attempt to dissolve the clot. Remember, if a part of your body feels unusually warm, it's not something to brush off. The fifth warning sign we covered was a heavy ache in the affected area. This can often be confused with tiredness or general aches and pains. However, it's important to understand that a persistent, unexplained ache could be your body's way of alerting you to a potential blood clot. Lastly, we highlighted shortness of breath as our sixth warning sign. This may occur if a blood clot travels to your lungs, which is a serious condition known as a pulmonary embolism. Don't dismiss this as simple exhaustion or a result of being out of shape. Each of these signs is a crucial piece of the puzzle in early detection and treatment of blood clots. They're your body's way of sounding the alarm, and it's important to heed them. Remember, early detection can mean the difference between life and death. Now that you know the warning signs, how can you prevent blood clots? Well, maintaining a healthy lifestyle is the first step. Regular physical activity can go a long way in keeping your blood flowing smoothly. When we move, our muscles help push the blood back up to the heart, reducing the risk of clot formation. Whether it's a brisk walk, a bike ride, or a swim, just get moving. If you're stuck at a desk most of the day, remember to take short breaks every hour or so. Stand up, stretch, or take a quick walk around the office. Hydration is another key factor in preventing blood clots. When we're well hydrated, our blood is less likely to thicken and clot, so make sure to drink plenty of fluids throughout the day. And no, that doesn't mean reaching for another cup of coffee. Water is your best bet, but herbal teas and natural fruit juices can also be good options. Avoiding prolonged periods of immobility is also crucial. This can be a challenge, especially during long flights or car trips, but there are ways around it. Try to get up and walk around every couple of hours. If that's not possible, at least flex and extend your ankles periodically to keep the blood flowing in your legs. Remember, prevention is always better than cure. So make these healthy habits part of your daily routine. Regular checkups with your doctor can also help detect any potential issues early on. If you have a history of blood clots or a family history of clotting disorders, you might need to take additional precautions. Your doctor can guide you on this. In the end, it's all about being proactive and taking charge of your health. Blood clots can be life-threatening, but with the right lifestyle choices and preventive measures, the risk can be significantly reduced. Your health is in your hands. Stay vigilant, stay active, and stay healthy.